First, though, from worries regarding your biological clock to managing the strain of IVF, Dr. Larisa Corda joins us now to take your calls and questions on fertility, and we're going to crack on. We've got Cassie on the line. Good morning to you, Cassie.
Good morning, everyone. How are you?
Very good. What's your question, please?
Basically, I've been in a long-term relationship for over 10 years. We've not decided either way on whether or not we will or won't have children, but I'm 36, so I think it will be kind of smart, really, to find out if there's any way that I can find my current fertility position, if that's possible.
OK, so can you find out how fertile you are?
Yes, there are means and tests that you can use to help assess how fertile you are, and I think that's a really good question, actually. And you're right to inquire and ask about that at the age of 36. None of the tests are perfect, and they're only estimates, but we do use a combination of hormone tests. There's one hormone in particular called anti-Müllerian hormone, which is produced by the ovaries and which can give us an indication of ovarian reserve in a woman. So an indication of how many eggs she may have left. It's not an exact number, it's not an exact science, and it doesn't really tell us much about the quality of those eggs, which is also important, but it helps. There's another hormone test which we can do, which is called follicle-stimulating hormone, which is a hormone produced by the brain, and that again can give us an indication of really how old the ovaries are. And then an ultrasound
How old they
scan.
are?
How old they are, exactly.
Well, could they be older than you?
No, they can't be older than you. So it's a question of essentially ovarian ageing taking place much like any other organ in your body.
Oh, right.
So the older you get...
So like anything, even if it was like the skin on the outside of your face, they can age faster.
So one of the main causes behind infertility is ageing, and as I mentioned before, the fact that we see a decline in the number and the quality of those eggs because they undergo ageing.
Where do you go to get this?
You can go to a fertility clinic. Your GP can do a referral for that. There are also lots of private centres which offer what are called ovarian MOT reserve tests, which you can have. And again, alongside with the hormone tests, it's important to do a pelvic ultrasound scan to assess the womb and the ovaries and to make sure there aren't any defects there.
OK, Cassie, lots of things to try there. Good luck with that.
Thank you, Cassie.